Hello, my name is Dr. Kayla White, and I will be discussing thyroid disorders, hypothyroidism, thyroid toxicosis, and thyroid antibodies. When looking at hyperthyroidism or Graves' disease, it is an immune disorder of the thyroid. Your thyroid overproduces thyroid hormones. The condition is more common in women under the age of 40. Symptoms can include anxiety, hand tremor, heat sensitivity, weight loss, puffy eyes, lid lag, and enlarged thyroid. You may be diagnosed by having an abnormally low TSH or thyroid stimulating hormone or a high T3 and T4. TSH secretion by the pituitary gland is regulated by the thyrotropin releasing hormone, which is secreted by the hypothalamus. Treatment includes certain anti-thyroid medications, and sometimes the thyroid is removed. Thyroid toxicosis, thyroid toxic crisis, or thyroid storm. It is rare but dangerous worsening of the thyrotoxic state in which death can occur within 48 hours if not treated. It can develop spontaneously, but usually occurs in individuals who have undiagnosed or partially treated severe hyperthyroidism and who are subjected to excessive stress from other causes. These could be things like infection, pulmonary or cardiovascular disorders, trauma, burns, seizures, surgery, especially a thyroidectomy, obstetric complications, emotional distress, or dialysis. It's caused by sudden release and increased action of T4 and T3 that exceeds metabolic demands. Symptoms of thyroid toxic crisis, they can include hyperthermia, tachycardia, especially atrial tachydysrhythmias, high output heart failure, agitation or delirium, nausea, vomiting, diarrhea, contributing to the fluid volume depletion. Treatment includes the use of drugs that block the TS synthesis, the use of beta blockers to control those cardiovascular symptoms, corticosteroids, iodine, and then supportive care. Plasma exchange or thyroidectomy may be used when medical treatment fails. Hypothyroidism is a condition in which the thyroid gland does not produce enough T3 and T4. Hypothyroidism deficiency of thyroid hormones, it can disrupt many things like heart rate, blood pressure, and all aspects of metabolism. Hypothyroidism is most prevalent in older women. The major symptoms include fatigue, cold sensitivity, constipation, dry skin, unexplained weight gain. Treatment consists of thyroid hormone replacement. Hashimoto's thyroiditis occurs when the immune system attacks the butterfly-shaped gland in the neck, your thyroid. Initially, the inflammation of the thyroid causes a leak, resulting in excess thyroid hormones, or hyperthyroidism. Over time, the inflammation prevents the thyroid from producing enough hormones, hypothyroidism. Symptoms include fatigue, unexplained weight gain. Treatment with synthetic hormone medications is usually effective. This type of hypothyroidism is also more common in women. When thyroid antibodies attack healthy thyroid cells, it can lead to an autoimmune disorder of the thyroid. There are different types of thyroid antibodies. Some antibodies destroy thyroid tissue. Others cause the thyroid to make too much of a certain thyroid hormone. A thyroid antibody test usually measures one or more of the following types of antibodies. You can look at the TPO, the thyroid peroxidase antibodies. These antibodies can be a sign of Hashimoto's disease. And we've discussed that. It could be a sign of Graves' disease as well. TG are thyroglobulin antibodies. These antibodies can also be a sign of Hashimoto's disease. Most people with Hashimoto's disease have high levels of both TG and TPO antibodies.